Good morning, everyone. Thank you for joining us today to release the AFL-CIO's annual Death on the Job report. We have a 5-person panel and we'll take press questions at the end. I'm going to turn it over to AFL-CIO Secretary Treasurer Liz Schuler to begin.
Hello, good morning, everyone. Thank you so much for joining us. The AFL-CIO, as you probably know, represents 12.5 million working people in 56 unions, all sectors of the economy. And we champion safe workplaces everywhere for all workers. And I just want to say a quick thank you, Rebecca Reindell. You've done an incredible job on this report. She's our AFL-CIO Director of Occupational Safety and Health, running a team. Want to thank the team and also all of the affiliate safety and health directors that have been working so hard together on this. Today, we also have President of National Nurses United, Zeni Cortez. I want to thank you, Zeni, for being here and for your incredible work through what everyone terms as unprecedented times, right? But your members, the incredible sacrifice they're making, we're just so grateful to you in the NNU. And speaking of heroes, we also have 2 other speakers here with us to share the worker perspective. Amalgamated Transit Union, or ATU Local 1555 BART operator, Yolanda Moreno, and Communications Workers of America, CWA, Local 3808 Executive Vice President and AT&T Sales Associate, Eric Chapman, who I believe is calling from Nashville, Tennessee. So today, as Rebecca said, we are releasing our 30th edition of our Death on the Job report. We've worked very hard on this report, so we're happy for the folks who joined us from the press. This coincides, as you may know, with the 50th anniversary of the Occupational Safety and Health Administration, or OSHA as we know it, which opened its doors on Workers' Memorial Day in 1971. And this is the occasion we remember the working people who've been hurt or killed on the job and renew our call to action for safe jobs. Workplace safety matters every day of the year, but it's been especially important as we continue to battle COVID-19 in workplaces. A primary source of COVID outbreaks have been America's workplaces. Thousands of workers have been infected and died, disproportionately people of color. And these infections and deaths were preventable through common sense measures that employers have fought against and the previous administration failed to enforce. And even before the pandemic, the last administration dragged us backward, attacked workplace safety protections, the structures for issuing those protections, and cut agency budget and staff. And they let businesses dictate and block rules that should have been in place to protect working people, the fox guarding the hen house, as they say. In 2019, the most recent data we have, 275 workers died every day from hazardous working conditions that were preventable. And about 95,000 workers each year die from occupational diseases that are often ignored. Job fatalities for workers of color, especially Black and Latino workers, increased. These workers are at greater risk of dying on the job. And the problems are structural. Workplace safety violation penalties are toothless. Underreporting workplace injuries and illnesses is pervasive. And the number of OSHA inspectors is near its lowest number since the agency opened 50 years ago. Get this, there are only 1,798 inspectors to inspect the 10.1 million workplaces under OSHA's jurisdiction. It's staggering. And workplace violence remains a serious and growing problem. as the third leading cause of job-related death. So all of this comes at a tremendous cost. Job injuries and illnesses cost about $250 billion to $330 billion a year. But in and amongst all of this darkness, there's some good news. The good news is we have a pro-union president, a pro-union vice president, pro-worker majorities in both chambers of Congress, and worker voices at the highest levels of government who can do something about it. And for the first time in a long time, there are opportunities for action on worker protection. In the past 50 years, job safety agencies have issued important life-saving regulations on hazards like silica and coal dust. And it's time to continue that progress. And COVID-19 is not over. It's going to remain a threat to workers for the foreseeable future. So we have to issue a strong emergency standard to protect workers from COVID-19. And it's a hopeful moment. It's an urgent moment for workplace safety, for our workers on the front lines and everywhere in the United States, and to make sure workers on every job in every state have a free and fair path to join with their coworkers and unions. That is what we believe can help make workplaces safer. So we must pass the PRO Act to make sure people can come together without fear and without retaliation, so they can speak up on the job and make their workplaces safer. So now I'm happy to turn things over to Rebecca Reindel to talk about what progress we hope to make and to present more details from our report. Rebecca.
Thank you so much. So the AFL-CIO started publishing this report 30 years ago because nobody was tracking the evidence about what was killing people and injuring people at work, nor the resources dedicated to job safety and health to prevent this from occurring, and nor identifying the areas of progress made and the areas where serious attention was needed. It was published as a national and state-by-state profile to bring to light the most significant areas and emerging trends in order to focus on major areas for prevention. And this year, we are not only looking back on 30 years of the report or only on 50 years of OSHA's existence, but on 50 years of worker protections that have been critical to saving lives. And more than 627,000 workers can now say their lives have been saved by the passage of the Occupational Safety and Health Act. And that doesn't count the hidden toll of those we lose from occupational diseases, which we don't even count in this country. OSHA and MSHA are public health agencies and play a critical role in public health response and prevention. They have full authority to require prevention measures in the workplace that prevent injury and illness and people dying. Over those 50 years, though, OSHA has been plagued with additional requirements and political blockades that have made its job more difficult. Since 1970, employment has increased and the number of workplaces have increased, but the number of OSHA inspectors and other resources at the agency's hands have decreased. OSHA's budget amounts to only $3.97 to protect each worker in the country. Over this time, we've made great strides in reducing the job fatality rate, but progress has stalled, remaining at 3.5 per 100,000 workers for several years now. And penalties have barely increased over time. Workplaces are structured differently now, and we need better tools for the job safety agencies like OSHA and MSHA to do their jobs. The data in this 30th edition of the Death on the Job report covers job fatalities, injuries, and illnesses from 2019, so immediately preceding the COVID-19 pandemic, job safety inspection data in 2020, and COVID-19 data that is available, although this has been limited due to severe gaps in collection requirements throughout the pandemic, especially by industry and occupation, for which we have continued to have very little information. The COVID pandemic is the most significant occupational safety and health disaster of our lifetimes. People learned that they had rights to a safe job, and they learned how difficult it is to improve their workplace conditions on their own. They learned the strength of unions and the consequences of not having government support from agencies that are supposed to oversee workplace safety. It showed us the clear differences between political administrations in handling of the crisis and political will in protecting people. It has been catastrophic for working age adults because the workplace is where the virus spreads through the air in the indoor, crowded, poorly ventilated spaces. It sent things into chaos because we were not prepared, but the preparation for this was put on the back burner for the last few decades. Clear evidence tells us the spread of this virus at work was and still is preventable, and because we know how to prevent airborne infectious diseases in the workplace. Racial inequities in job safety have long been prominent at work, but the great progress we made in this area in recent years fell off under the Trump administration. In 2019, leading up to the pandemic, there was a sharp increase in Latino worker job fatality rate from 3.7 to 4.2. This increase was largely among immigrant workers, and this rise comes after years of progress, bringing the Latino job fatality rate down with national and regional targeted interventions. 2018 data show the Black worker fatality rate increased for the first time in at least 5 years. And in 2019, the number of fatalities increased to the highest number in more than 2 decades, 634 Black worker deaths. This was a 50% increase over the past decade. COVID-19 has hit the hardest in workplaces and occupations largely made up of people of color and low-wage workers, exposing the severe attention deficit to workers and communities treated as disposable and vulnerability to their employers. We noticed something else under the Trump administration. The Bureau of Labor Statistics restricted the collection and publication of some critical job fatality data on many workers at greatest risk of unsafe working conditions, and this includes immigrant workers and contract workers. But we have a lot more work to do. Worker safety agencies, OSHA and MSHA, were created in the 1970s, but the need for them is not long gone. More important than ever, we must bolster these agencies and the resources they need to hold employers accountable for violating safety and health laws, and bolster unions to improve workers' voice when they feel unsafe working conditions, when they face unsafe working conditions for a paycheck. Most immediately, people need strong, comprehensive workplace protections from COVID-19. COVID-19 outbreaks are far from over, and they are occurring across workplaces. Working age adults are at greatest risk, and workplaces reopening now must have strong protections in place in order to save lives by preventing exposures. The COVID-19 pandemic has highlighted the need for a permanent infectious disease standard, and chronic exposures to toxic chemicals in the workplace still kill near 100,000 workers each year, and most of these deaths go unnoticed. Mining workers still need protections from silica dust, and workplace violence remains a significant and growing problem. Employment classification and fractured workplaces have made success through traditional models of workplace protections harder to reach. And we have emerging issues that will need continued urgent responses to save lives. Our report and some infographics are available on the website. I'm turn it over to Yolanda Moreno.
I'm Yolanda Moreno. I've been a member of the Amalgamated Transit Union Local 1555 for 30 years. I come from a union family where my father was a mechanic and my mother was a teacher's aide. It was when my father began working for a company that had a union that things kind of changed for our family. When I was a kid, I used to think that the doctor and the dentist were free because I never really saw my parents bring their wallet out to pay for anything at those appointments. It wasn't until I got older that I realized those things were really expensive. I currently work as a train operator for the Bay Area Rapid Transit District. Prior to becoming a train operator, I was a station agent for 11 years. I'm a union steward at my local, where we represent almost 1,000 employees at BART, including train operators, station agents, floor workers, and clerks. I'm honored to represent the ATU and AFL-CIO for this important event, marking 50 years of worker protections by the Occupational Safety and Health Administration. The COVID-19 pandemic has shined a spotlight on the importance of safety on the job for all workers, and especially ATU members and other frontline essential workers like nurses and healthcare workers, grocery and farm workers. My fellow workers at BART and all ATU members across North America have been frontline heroes since day one, risking their lives to provide critical transportation. At BART, we never shut down. It was the same for many transit systems across the country where we were and still are necessary to getting other essential workers to their jobs. The ATU has lost 151 brothers and sisters to this deadly virus. 4,700 have been infected and 4,400 remain laid off in the United States and Canada. In California, we've lost 19 members. At my local, we've had 168 employees infected. And just as we began to see the light at the end of the tunnel this last month, we lost a great coworker and friend, Sean Rollerson, to COVID. It shocked a lot of us because I feel like we all felt that, we were going to be fortunate enough to get out of the pandemic and not lose one of our brothers or sisters. Since the beginning of the pandemic, our local and ATU have been fighting and winning protections for our members. At ATU Local 1555, we saw the devastation that COVID had in New York City and New Jersey and other places on the East Coast, and how it especially impacted transit workers. We knew we had to prepare and push for protections for safety for our members and our riders, and we immediately began to fight for masks and PPE. Many locals had to purchase masks and gloves for their members, and as the companies that they worked for were hesitant, and in some cases, were even discouraging members from wearing masks and other PPE. We asked for passenger limits on buses and more service to reduce overcrowding, improved ventilation and filtration on trains, and sanitizing all vehicles, stations, and work areas for BART operators, station agents, and mechanics. The Biden passenger mask mandate helped save lives, and the last administration would not mandate masks. However, the mask mandate has turned BART and all transit workers into the mask police. It led to confrontations between passengers and transit workers. And we had an agent ask a passenger to wear a mask, and his response was to spit at her. The ATU has been working with transit agencies, private contractors, and elected officials to move quickly to deliver needed protections with mask mandate to ensure the transit workers are safe and riders comply. At our local, we work with BART to ensure our safety, and police have been available to enforce the mask mandate. Agencies must continue to implement other protections, social distancing measures to prevent overcrowding. Transit workers must be supplied with adequate and proper PPE. But long before the pandemic, attacks on BART workers have been a problem. Spitting, verbal abuse, and worse. For station agents and train operators, it had become part of our job. As a female, it's not unusual to be called a bitch. As a person of color, most of those time, those verbal abuses are racial slurs. Just a few evenings ago, we had an operator just sweeping the train at the end of the night, getting all the passengers off the train because the train was going out of service. And a passenger pushed her and kicked her, and it was unprovoked. Those attacks are usually happen over payment of fares, also drunk and angry passengers who just take it out on other BART employees. ATU has been pushing for vaccine priority for our members. We've sent letters to governors asking to classify BART and other transit workers as essential. In California, our members have been given vaccine priority, and many members have been vaccinated. Now members in other states are being vaccinated as well. But our members in Canada still have not been prioritized for vaccines. The pandemic has highlighted the need for improved safety on the job for transit workers and all workers. OSHA must do more to protect transit and all workers during this pandemic and beyond.